I think mental health crisis is nationwide. We hear it every day on the news. It is definitely a service that all of us are here to serve and to provide services for as well.
Ardell Bigos, the chief nursing officer at Finger Lakes Health, has never seen more of a need for mental health services.
We have to be here as a community organization working with different counties to be able to provide those services. Again, not just to the community that needs it, but also to our employees as well that and again, healthcare workers that really deserve to have those services.
According to Attorney General Letitia James, New York is in the midst of a mental health crisis that worsened during the pandemic. John Eichenberger, a licensed mental health counselor and sole proprietor of Hope and Health Counseling in Geneva, says people nowadays are experiencing unprecedented levels of stress.
A lot of the bad news we're getting about shootings, I think also economic worries are a part of that. And I think the other mental health crisis is that there are a great many people seeking help, and there's not enough professionals to go around.
Amanda Felice agrees, as she's never experienced anything like this in all her years as a licensed mental health therapist and the director of behavioral health at Finger Lakes Community Health.
We're trying to work together to kind of assist this crisis because it's definitely, I've been in the field a little over 10 years and I've never seen anything like this before.
According to Bigos, what would help the most with these shortages of mental health providers and not enough appointments for patients is to expand technology.
I think across healthcare, we just have to keep expanding on the technology tools that we have available to reach out to the communities. And collaboration is number one, too. How do we work, to your point, with state officials, with the Office of Mental Health, with the counties? How do we work all together to be able to provide those services?
New York State is waiting on Governor Hochul's signature for new legislation that would expand the scope of mental health specialist practices. Bigos believes new legislation, along with new technology, will help with the current crisis.
I think any time that you're able to expand on somebody's scope of a licensure and enables them to do a little bit more, that definitely helps, especially I can speak to healthcare. That allows us to take one more step further in order to meet the needs of the patients, residents, and the community. So I think any bill that expands that, especially when you have a crisis, now trying to get staff in to do, bedside, and again, all across healthcare, doesn't matter. But I think when you expand those abilities and those responsibilities, that it definitely helps the situations.
For FingerLakes1.com, I'm Megan Hatch.